Hi, morning, girls. Hi, how are you? Yeah, it's so great to see you again this week. And for today's lesson, we will talk about the vital signs. And we are so lucky here to have Novi as well to do the translation. Okay. Okay, so before we start our lessons, let's do some revisions. Okay, do you still remember what we have talked about last week? The oral care? Yeah. Still remember? So starting from last week, they use the correct method to do the to use the correct method.
Jadi masih ingat pelajaran minggu lalu tentang perawatan gigi dan mulut? Ya. Jadi kan teman-teman menggosok giginya sudah sesuai benar belum? Sudah. Masih ingat cara gosok giginya kan ya?
Still remember, okay? Okay, so let's do some revisions. Here we got the demo here, and we got the toothbrush here. Still remember how many teeth as a group?
Masih ingat berapa banyak giginya?
Two or three, well done. Yeah, okay, so we use our toothbrush and 2 to 3 as a group. Okay, how many times? 10 times. Wow, excellent. Okay, 10 times as a group. Okay, and do the cleansing like this one. And this is for the lower part. And for the upper part, 2 to 3 as a group for 10 times.
Di bawah 2 atau 3
Okay, you can pass.
10 kali, yang di atas juga sama beberapa kali. Masih ingat ya? Sudah dilakukan di rumah? Ini ada yang tersenyum, kesannya belum ya?
Okay, so and here's we also got the dental floss here. Yes, and here's our teeth. So you can see actually the teeth got some problem, the decay, tooth decay.
Kita bisa melihat di sini giginya ada sedikit masalah, karies gigi.
Okay, so actually the inside, the inner part of our teeth is not like this one.
Jadi dalam gigi kita itu bentuknya seperti itu, teman-teman.
Yeah, we got some blood vessels here and the nerve also inside our teeth.
Nah, di saraf-saraf kita juga ada di dalam gigi kita.
Okay, so what we are going to use the dental floss is to clean the gum area.
Jadi dental flossnya dipakai untuk membersihkan di daerah gusi.
Okay, if our gum areas stop breathing after we use the dental floss, will we continue to do this or stop?
Jadi kalau misalnya saat kita menggunakan dental floss dan gusi dan darah, kita lanjut pakai flossnya apa tidak?
Continue? Yeah, well done. Okay, so we use our dental floss to clean our gum area like this one. And here's the demo you can pass. One morning.
Coba sendiri ya teman-teman cara menggunakan dental floss di giginya.
Okay. So do you have any questions regarding to the content of our last lesson?
Ada yang mau bertanya terkait materi yang disampaikan minggu lalu?
No, okay, so let's start our lessons today about the vital signs observations, and it includes the blood pressure monitoring, the body temperature, and also the blood glucose level.
Jadi hari ini kita akan belajar terkait pengamatan tanda-tanda vital yang termasuk di dalamnya mengukur tensi darah, suhu tubuh, dan kadar gula darah.
Okay, so let's start our precast quiz as well. So number 1, our blood pressure, body temperature, and also the blood glucose level are important vital signs to indicate the body's status. True or not true?
Jadi ini kita mulai pre-class quiznya. Yang pertama, tekanan darah, suhu tubuh, dan kadar gula darah adalah tanda-tanda vital yang penting untuk memperhatikan kondisi tubuh. Iya atau tidak?
Okay, yes, okay. So, question 2, diastolic blood pressure is the pressure produced on blood vessels during contraction of the heart.
Oke, yang kedua, tekanan darah diastolik adalah tekanan yang ditimbulkan oleh pembuluh darah saat jantung berkontraksi atau saat beraktivitas. Iya atau tidak?
Okay, some say yes, some say no, and let's have the answers later. But remember the word contraction. Let's think about is contraction or relaxation.
Jadi nanti kita bahas jawabannya. Tapi teman-teman tolong diingat ya, nanti akan ada 2 kata yang paling sering muncul, kontraksi dan relaksasi. Kontraksi itu ingat untuk aktivitas, bergerak atau berkegiatan. Relaksasi itu aktivitas dan beristirahat. Diingat dulu ya.
Okay, so question 3. Normal systolic pressure should less than 120 mmHg, while normal diastolic pressure should be less than 90 mmHg. Let's think about the correct number.
Nah, yang ketiga, tekanan darah sistolik itu harus di bawah 100, tekanan di bawah 120, sementara untuk tekanan diastolik di bawah 90. Iya atau tidak?
Okay, so let's think about this one. And also the question 4. Which type digital sphygmomanometer is more accurate than the arm type sphygmomanometer? So what is an arm type sphygmomanometer? Is just like this one, and we have the demonstration later. And the arm type is hold like this one, and the wrist is here.
Nah, yang keempat, sphygmomanometer atau alat ukur tensi yang dipasang di pergelangan tangan lebih akurat dibanding alat ukur tensi yang dipasang di lengan teman-teman. Iya atau tidak?
No? Okay. So question 5. The arm type digital sphygmomanometer should be placed at the same level as the heart before measuring the blood pressure.
Oke, alat ukur tensi yang dipasang di lengan harus setara dengan jantung sebelum mengukur tensi darah. Iya atau tidak?
So when measuring our ear temperature, the probe should be pointed slightly forward and downward along the ear canal towards the tympanic membrane. That means when we measure the ear temperature, our ear should be just like this one, move slightly forward and downward. Is this correct? Let's think.
Jadi saat mengukur suhu tubuh dari telinga, ujung termometer itu harus ditekankan sedikit atas dan bawah dalam saluran telinga ke arah gendang telinga. Iya atau tidak? Yes.
Okay, so question 7. In general, rectal and tympanic, that means the ear temperature, okay, are 0.5 degrees Celsius lower than oral temperature. True or not true?
Secara umum, suhu tubuh yang diukur di telinga dan di dubur itu 0,5 Celsius lebih rendah daripada suhu tubuh yang diukur di mulut. Iya atau tidak? Jadi iya atau tidak?
No. Okay. So question is, avoid exercise, smoking alcohol, coffee, or tea half hour before measuring the blood pressure. True or not true?
Oke, jangan kita tidak boleh berolahraga, merokok, meminum alkohol, minum kopi atau teh setengah jam sebelum mengukur tensi darah. Iya atau tidak? Yes.
Okay, so some say yes. And for question 9, regular time for home monitoring of blood glucose level of diabetic elderly include before breakfast, before meal, and 2 hours after meal and at bedtime.
Oke, jadwal pengukuran kadar gula darah secara rutin di rumah untuk lansia yang mengidap diabetes, termasuk sebelum sarapan, sebelum makan, 2 jam setelah makan, dan saat sebelum tidur. Iya atau tidak?
Yes. Okay, so question 10. For elderly with extremely high or sudden drop of blood pressure, need to seek the medical consultants at once.
Jadi dan untuk lansia yang gula darahnya tiba-tiba naik atau tiba-tiba turun, kita harus segera menghubungi dokter. Iya atau tidak?
Yes. Okay, so let's turn to the next page. And today we are going to talk about the vital signs. Actually, vital sign is very, very important. No matter you are a medical professional today or you are just a normal citizens. If you know the principles of vital signs, actually it can help you and also your family and also the family you are taking care of. Because vital sign is the first initial health assessment for to assess a body's condition.
Jadi tanda vital itu penting tidak hanya untuk lansia dan tidak hanya diketahui oleh tenaga kesehatan, tapi juga untuk kita sebagai warga biasa. Karena dari tanda vital itu kita bisa menilai kondisi tubuh seseorang. Jadi ini sangat berguna tidak hanya untuk lansia yang kita jaga, tapi juga untuk keluarga kita atau jika ada orang yang membutuhkan bantuan.
Okay, so actually the vital signs include blood pressure, body temperature, pulse rate, respiration, and blood sugars level. And today we will mainly focus on blood pressure, the body temperature, and also the blood glucose level.
Tanda kita itu sebenarnya banyak. Salah satunya tensi darah, suhu tubuh, denyut nadi, pernapasan, dan kadar gula darah. Tapi di kelas ini kita sekarang akan bahas tentang tensi darah, suhu badan, dan kadar gula darah.
So, okay, let's start the blood pressure first. Actually, what is blood pressure? Blood pressure is the pressure produced on our blood vessels during the contraction and relaxation of our heart.
Nah, jadi tensi darah itu apa sih? Tensi darah itu adalah tekanan yang ditimbulkan oleh pembuluh darah kita saat jantung berkontraksi atau berrelaksasi. Jadi tadi masih ingat ya yang saya sebutkan tentang kontraksi dan relaksasi?
That means our heart actually, how does it function? It will just like this one, contract, relax, right? So during the contraction, it will generate a pressure on our blood vessels. And the pressure is called systolic blood pressure for the contraction. Okay, so for our heart, when it is at a relaxation status, actually it's called the diastolic blood pressure.
Jadi yang tadi teman-teman mungkin masih bingung, yang jantung itu berdenyut seperti ini, lalu seperti ini. Saat dia seperti ini, itu namanya tekanan sistolik saat dia berkontraksi. Lalu saat dia berdenyut seperti ini, itu namanya diastolik. Itu berarti jantungnya sedang beristirahat, sedang berrelaksasi.
So now, what is hypertension? Okay, anyone's got hypertension?
Di sini ada darah tinggi.
No? Oh, okay. Because hypertension is very common. No matter where you are, no matter you're in Hong Kong, in Indonesia, Philippines, or in the US, it's very common. So, according to the WHO, hypertension is defined as the systolic blood pressure is equal or higher than 140 mmHg, and the diastolic blood pressure is equal or higher than 90 mmHg.
Jadi tensi darah itu juga cukup umum ya, tidak hanya di Indonesia, atau orang di Hong Kong pun juga bisa terkena darah tinggi. Menurut WHO, darah tinggi itu bisa didefinisikan saat tekanan tensi darah sistoliknya lebih dari angka 140 dan saat tensi darah diastoliknya setara atau di atas 90.
So if your blood pressure readings were above the normal range, for 3 consecutive measurements and at least 2 weeks apart, then you got hypertension.
Jadi bagaimana cara kita menilai kita punya darah tinggi atau tidak? Saat kita mengukur tensi darah kita 3 kali dan setiap pengukuran itu jaraknya 2 minggu. Dan jika angkanya terus-terusan di atas angka normal, maka kita disebut hipertensi.
Okay, so that means, for example, if for our practice later, if you measure your blood pressure is very high, don't be nervous, okay? Because we need to have a range of 3 consecutive measurements and at least 2 weeks apart. Keep some observations for the readings.
Jadi nanti di akhir kelas kita juga akan mencoba sendiri alat ukur tensinya. Jadi kalau nanti teman-teman pas diukur tinggi, tekanan darahnya tinggi, jangan panik ya. Bukan karena kita berkali teman-teman hipertensi, tapi nanti harus ada observasinya, ada 2 minggu, ada jarak 2 minggu dan harus 3 kali berturut-turut.
So actually, it's very important to measure the blood pressure of the elderly because this is one of the very important vital signs, and we can determine the treatment whether it's effective or not.
Jadi tensi darah itu sangat penting untuk para lansia karena ini adalah salah satu dari yang paling penting. Dan dari tensi darah kita bisa menentukan apa saja perawatan yang diperlukan oleh para lansia.
So what is the frequency of measuring the blood pressures? How long do you measure the blood pressures for the elderly at your home? Once a week?
Teman-teman ada yang sudah mengukur tensi lansia yang dijaga di rumah? Berapa kali seminggu? Setiap hari. Setiap hari berapa kali? 2 kali.
Twice every day.
Twice a week every day. Anyone measure the blood pressures daily?
They do it daily and then
One in the morning and one at the night time.
Jadi 1 pagi, 1 malam.
Yeah.
Wow, okay, that's good. Actually, what is the frequency of measuring the blood pressure? Actually, it depends on the elderly person's condition. Okay, for example, the regular BP, the blood pressure monitoring is like for weekly. Okay, so and stable hypertensive elderly are advised to have regular clinic follow-up in every 3 months. So if you have any elderly at your home got hypertension, they need to have the follow-up, right? And the follow-up is usually every 3 months in Hong Kong.
Oke, jadi untuk mengukur tensi tentu tergantung dari kondisi para lansia yang dijaga. Tapi untuk para lansia yang memiliki darah tinggi dianjurkan untuk kita memonitor setiap minggu peningkatannya dan untuk kita follow up ke dokter atau klinik yang merawat lansia tersebut setiap 3 bulan sekali.
Okay, so we can check the blood pressures periodically with family history of hypertension, for example, once a year, and avoid checking the blood pressure repeatedly within a very short period of time. That means we need to repeat our measurements and wait at least for 10 to 15 minutes. That means the time period we need to wait for a very short period of time for measure our blood pressure, okay?
Di sini ada Mbak Sri Hartati, Mbak Novemberin atau Pak?
Okay, so now let's watch a video about what is blood pressure.
Sekarang kita tonton video dulu tentang apa sih itu tekanan darah.
To provide your cells with oxygen. As pumping of blood puts pressure on the walls of your blood vessels. This is referred to as blood pressure. The blood pressure varies as your heart muscle contracts and relaxes, which is why your blood pressure measurement is 2 numbers, not 1. It's higher during contraction and lower between heartbeats. When your numbers get too high, you're increasing your risk of stroke, heart and kidney disease. High blood pressure means your heart is working harder to move blood around your body. As the arteries become narrower, the pressure increases. In the same way you need very high pressure to move water through a blocked hose. But because high blood pressure doesn't usually cause symptoms, many people may not know that they have it until damage has occurred. So get your blood pressure checked. If it's high, talk to your doctor about taking steps to get it under control. And keep an eye on it. If those steps include medicines, stick with it, or it won't protect you.
So here's our heart and here's our blood vessels. And every time during our heart contract and relax, it will generate a pressure here. Okay, so why it's very important to measure our blood pressure? Because if the pressure is too high, and then you will damage our blood vessels. And you will lead to some problems like stroke, or headache, or vomit, or we need to go to the hospital at once.
Jadi bisa dilihat di sini ya, sebelah kanan itu jantung, sebelah kiri ada pembuluh darah. Jadi saat jantung kita berdenyut, berkontraksi, berrelaksasi, dia memompa darah ke seluruh pembuluh darah kita. Jadi apa yang terjadi kalau jantung kita berdenyut terlalu cepat? Nanti kita bisa membuat pembuluh darah kita rusak karena terlalu banyak darah yang dipompa. Dan itu bisa menimbulkan banyak kerusakan untuk kita. Misalnya teman-teman bisa tiba-tiba sakit kepala atau paling parahnya kita bisa mengalami stroke.
Okay, so this is the arm heart sphygmomanometer, And this is the wrist sphygmomanometer. Okay, so do you think which one is better?
Nah, di sini ada dua alat ukur tensi, tensi yang di lengan yang biasa sering teman-teman lihat kalau di dokter, dan ini yang di pergelangan tangan. Menurut teman-teman mana yang paling efektif?
The arm one. So we don't use we don't use this one, and usually we use this one. Do you got this at your home? Yeah. Okay. Have you tried to use the arm one before?
Yeah.
You know how to use this? Really? Okay, we'll do the examinations later. Okay. So how to use the sphygmomanometer? First, we got some preparations. Like the environment need to be quiet and comfortable. So ask the elderly to sit on the chair, purposely, and measure the blood pressure at the same time of the day. That means if today you used to measure the blood pressure at the morning, then measure the blood pressure at the morning every day.
Oke, jadi apa saja sih yang harus kita siapkan sebelum kita mengukur tensi darah? Yang pertama, pastikan ruangannya nyaman, suhunya juga tidak dingin, tidak terlalu panas, nyaman untuk para lansia. Lalu saat kita mengukur tensi, pastikan jika kita mengukur tiap hari itu dalam waktu yang sama. Misalnya kita mengukur tensi darahnya jam 10 di pagi ini, maka besok kita juga mengukurnya di jam 10, jadi di jam yang sama.
Actually, it's very important to avoid exercise, smoking, and also alcohol, coffee, beef, or tea half an hour before the measurements.
Okay. Jadi ini paling penting, kita tidak boleh berolahraga, merokok, minum alkohol, minum kopi, atau minum teh setengah jam sebelum mengukur tensi darah.
And also advise the elderly to sit and rest for at least 5 to 15 minutes before the measurement.
Jadi kita juga meminta para lansia untuk tetap tenang dan diam 5-15 menit sebelum kita mengukur tensinya.
So why? Do you know why? What's the reason?
Tahu nggak kenapa? Kenapa nggak berolahraga? Kenapa harus duduk diam dulu? Coba, kenapa?
Kalau habis olahraga itu detak jantungnya cepat.
When they use a lot or exercising, the heart rate will pick up. Will be faster.
Okay. The heartbeat will be faster, and also the blood pressure will also be higher. After they finish the exercise or after smoking coffee, actually the blood pressure should be higher than the usual one. So we need to ask them to rest for 15 minutes. Even if they told you, oh, it's okay, help me measure. No, they need to rest for 5 to 15 minutes.
Kalau misalnya kita melakukan kegiatan-kegiatan ini, saya beraktivitas, minum kopi, minum teh, atau cuma jalan-jalan saja, itu memang membuat kita hanya detak jantungnya jadi cepat, tapi juga pembuluh darahnya. Nah, jadi biarpun nanti lansia kayak, oh nggak apa-apa, udah saya ukur aja biar cepat gitu. Jangan. Jadi pastikan detak jantungnya tetap stabil, jadi dia tetap tenang, jadi kita bisa mengukur dengan lebih akurat.
Okay, so there's some few things we need to pay attention before measuring the blood pressure. And the first one is if the sleeve is too tight, we need to lose it before the measurements, especially during the winter. And the winter is coming, and we all have our thick clothes. We need to remove the sleeves first before the measurements.
Jadi apa saja sih yang harus kita perhatikan sebelum mengukur tensi? Yang pertama, terkait ini ya, pakaian yang dikenakan. Kan sekarang kalau lagi musim dingin kan kita pakai bajunya yang rada ketat ya, rada ketat biar hangat. Nah, itu harus kita longgarkan sebelum kita mengukur tensi.
Yeah, otherwise you will got a very abnormal reading, either too high or either too low.
Jadi nanti kalau misalnya kita misalnya si pakaiannya terlalu ketat saat kita mengukur, nanti pengukurannya jadi aneh, jadi abnormal, bisa tiba-tiba terlalu tinggi atau malah jadi terlalu rendah.
And also rest the elbow over the table or cushions to support the arm. That means like this one. We need to have a table and put our arms here. If the elderly asks you to measure just like this one, will you do this? No. Okay.
Jadi kalau mengukur tensi ya harus tahu ya, kita harus menaruh sikunya di atas meja seperti ini. Jangan sampai di pinggir tubuh, jadi harus ada yang menopang lengannya.
Okay, the reason is because we need to place our blood pressure monitoring at the heart level before the measurement. So if we sit down, actually we put our arms here, is within our heart level.
Jadi kenapa harus ditetapkan seperti ini? Karena pengukurannya harus setara dengan jantung. Jadi kita naruh di sini, yang pengukur tensi kita di lengan itu setara dengan jantung kita. Jantung kita ada di sini kan? Nah, jadi ini setara.
Okay, sure. So just like this one, loosen our sleeve and also rest over the table, just like the pictures here.
Seperti ini gambarnya ya.
And at the heart level, okay? So actually there are some procedures. First, we need to explain the procedures to the elderly. Okay, so now I'm going to measure your blood pressure. Please sit properly. Explain the procedure for them.
Nah, jadi prosedur-prosedur apa sih yang kita ambil saat sedang mengukur tensi? Yang pertama kita menjelaskan prosedurnya pada lansia. Siapa namanya Popo ya? Popo, saya mau mengukur tensinya ya, duduk ya, yang tegap, tangannya sebelah sini.
And very important, the elderly or the patients do not talk during the measurements. They like to talk to you a lot during the blood pressure monitoring. Okay, just keep silence.
Nah, jadi saat mengukur tensinya kita jangan bicara. Jadi kalau misalnya Popo yang ngajak ngobrol gitu, banyak biasanya cerewet gitu kan, nah udah kita diem aja. Popo tenang ya, udah mau diukur dulu.
Because this will affect the reading. So, and also need to make sure the elderly is relaxed and a very comfortable position.
Dan pastikan juga para lansianya duduk dengan nyaman dan relax, jadi santai.
And also maybe some of them will feel a little bit discomfort during the process, so just reassure them.
Dan kalau misalnya para lansia mungkin merasa tidak nyaman, ya mungkin karena saat ini kan teman-teman juga tahu kalau mengukur tensi agak ketat di sini ya. Nggak apa-apa, tenangkan saja para lansianya, pastikan bahwa prosedurnya dilewati dengan nyaman.
Monitor your blood pressure using an automatic blood pressure machine. Sit comfortably for about 5 minutes before taking the measurement. Make sure your back is supported, feet are flat on the floor, legs uncrossed, and roll up your sleeves if needed. Then place your arm on the table, palm upward, even with your heart. Then place the cuff on your arm 1 inch above your elbow pit. Make sure the artery line or the tube falls in front center of your arm. And wrap the cuff around with the appropriate snugness. The cuff should be placed tight enough so that you can fit 2 fingertips at the top end of the cuff. To get started, press start and remain still and quiet as the machine is measuring. The cuff will inflate and slowly deflate to get accurate measurement. When the reading is complete, the machine will display the blood pressure reading intervals. Record your numbers daily, either by writing it down in a journal or entering it into your phone or laptop.
Okay, so just now is the process of measuring the blood pressure, and after you have your measuring, we need to wait a moment. We need to have the documentations after the measurements, just like this one.
Jadi tadi kan prosedur untuk mengukur tensi. Nah, saat kita mengukur tensi, kita harus menyiapkan catatan. Catatannya bisa dilihat seperti ini.
And first, we need to write down the dates and also the time and also the readings of each time's measurements.
Nah, jadi yang pertama dulu kita tulis tanggalnya, misalnya tanggal hari ini, tanggal 8 November, lalu kita tulis jamnya, kapan kita mengukurnya, lalu kita tulis angka yang sudah diukur, tensinya misalnya berapa.
Sometimes we can also write down the medications. And the Aldomet 500 mg 3 times a day, actually Aldomet is a hypertensive drug.
Nah, jadi kalau misalnya para lansia yang kita jaga juga minum obat, kita juga bisa mencatatnya. Misalnya di sini angkanya seperti itu karena dan obat yang diambil adalah Aldomet 500 mg 3 kali sehari. Itu juga kan karena obat yang berkaitan dengan kesehatan jantung.
So why it's very important to write down the medications? Because if you skip sometimes, your blood pressure will be very high.
Nah, kenapa penting untuk mencatat obat-obat yang diambil? Karena kadang jika kita meminum obat tersebut, tekanan darah kita jadi lebih tinggi.
And we know that the patients forget to take the afternoon dose.
Dan kita juga bisa mencatat kalau misalnya lansia yang kita jaga ternyata lupa meminum dosisnya yang untuk siang hari.
Do you have this one at your home?
Dicatat kayak gini kan di rumah?
Yeah, remember we need to write down the readings every time after the measurement.
Jadi ingat ya, setiap sudah diukur tensinya harus langsung dicatat angkanya.
Okay, so now this is very important because what is normal and what means hypertension, we can see this table.
Jadi bisa dilihat di sini ini angkanya. Jadi apa sih yang disebut sebagai darah tinggi, darah rendah, dan apa yang akan disebut sebagai normal biasa atau normal agak tinggi dikit. Bisa dilihat angka-angkanya di sini.
Okay, first we need to pay attention to hypotension first. So what is hypotension? If your systolic blood pressure is lower than 100 mmHg and your diastolic pressure is lower than 60 mmHg, that means you got hypertension. And the patients who got hypertension may feel very dizzy or very discomfort. Their face will turn white or pale.
Jadi yang pertama kita lihat adalah darah rendah. Darah rendah itu apa sih? Darah rendah itu saat tekanan sistoliknya di bawah 100 dan tekanan diastoliknya di bawah 60. Pada pasien yang terkena darah rendah biasanya nanti muka mereka pucat, mereka jadi lebih sering pusing dan semacamnya.
So for the normal blood pressure range, for the systolic blood pressure, it should be like between 100 to 129 mmHg, and for the diastolic pressure, it's just like 60 to 84 mmHg.
Jadi untuk tekanan darah normal itu kisarannya untuk sistoliknya angkanya di antara 100 sampai 129 dan untuk diastoliknya di antara 60 sampai 84.
So every time if you see the range is normal, you'll be very happy. So remember this range. Yeah, for the high normal, actually it's within 130 to 139 mmHg, and also the diastolic pressure is in between 85 to 89 mmHg.
Jadi kalau teman-teman saat mengukur tensi dapat yang normal, kita berbahagia ya, berarti dia tidak darah rendah, dia darah tinggi. Lalu ada juga namanya high normal atau normal agak tinggi sedikit. Itu kisaran untuk sistoliknya di antara 130 sampai 139 dan untuk diastoliknya di antara 85 sampai 89.
So what is high normal? It means it tells you, okay, we need to pay attention to the readings. Actually, we can do some exercise or the diet modification in order to make our blood pressures to be normal. And at this stage, it's okay not to take any hypertensive drugs.
Oke, jadi apa sih yang disebut sebagai high normal atau normal tinggi? Jadi ini semacam indikator untuk teman-teman untuk mulai memperhatikan tekanan darah teman-teman. Di fase ini tidak perlu untuk meminum obat-obat yang untuk menurunkan darah tinggi ya, tapi bisa kita tanggulangi dengan lebih banyak berolahraga atau mungkin mengubah pola makan, mungkin mengurangi makan makanan yang seperti kafein atau yang mungkin bisa membuat detak jantungnya lebih cepat.
But if your systolic blood pressure is higher or equal to 140 mmHg and the diastolic blood pressure is higher than 90 mmHg, then it means you got hypertension. And at this stage, if you see the doctor, they will prescribe the hypertensive drug at this stage.
Nah, kalau darah tinggi itu apa? Nah, darah tinggi itu yang di atas 140 untuk tekanan sistolik dan tekanan diastoliknya di atas 90. Kalau teman-teman ke dokter dengan keluhan darah tinggi ini, para dokter akan berikan teman-teman obat untuk menanggulangi darah tinggi tersebut.
Okay, so here's the hypertension, and we have just come across this, and the management is consult the doctor for checkup.
Nah, jadi ini yang tadi kita bahas terkait darah rendah. Jadi bagaimana kita membantu para lansia dengan darah rendah? Kita hanya berkonsultasi pada dokter.
Okay, so for the high blood pressure, if your blood pressure is really too high, like in between systolic blood pressure 140 to 179, and the diastolic pressure is 90 to 109, and we need to arrange the early clinic follow-up to consult the doctor, and we need to check our blood pressure regularly.
Jadi untuk yang darah tinggi, yang di antara jika sistoliknya di antara 140 sampai 179 dan diastoliknya di antara 90 sampai 109, kita harus mengunjungi follow up, kita rutin setiap ke dokter dan harus secara rutin mengukur tensi darahnya.
Why is regular checking very important? Because at this stage, sometimes they got no sign and symptoms for hypertension at early stage.
Kenapa mengecek tensi secara rutin penting? Karena darah tinggi itu tidak ada gejala, tidak ada tanda-tanda. Jadi sangat penting untuk kita mengukur tensinya sebelum memunculkan gejala-gejala yang mungkin tidak kita inginkan.
So if you don't measure the blood pressure, actually we don't know the patient got hypertension at this stage.
Jadi di sini kalau kita tidak mengukur tensi darahnya, mungkin kita tidak tahu kalau pasien tersebut sebenarnya mengalami darah tinggi.
But once they reach this stage, actually it's very, very dangerous. If your systolic pressure is higher than 180 mmHg and your diastolic pressure is higher than 110, and that means your blood pressure is very high and you got the risk like stroke. We need to see the doctors as soon as possible.
Ini yang paling, dan jika terjadi seperti ini di mana sistoliknya lebih tinggi dari 180 dan diastoliknya lebih tinggi dari 110, itu berarti tekanan darah sudah sangat tinggi dan ada kemungkinan ini akan menimbulkan gejala stroke. Jadi apa yang harus dilakukan? Kita harus segera mencari dokter secepat mungkin.
If the patient's got some symptoms like headache, foaming, or very discomfort, that means they have already reached this stage and not this one.
Jadi jika para pasiennya sudah pusing, muntah-muntah, nah itu berarti mereka sudah mencapai yang paling akhir ini, yang very high, tekanan darah yang sangat tinggi. Jadi kita segera menghubungi dokter.
So it's very important and very dangerous at this stage. We better measure the blood pressure regularly.
Karena sangat berbahaya untuk hal ini, jadi itulah kenapa kita harus secara rutin mengecek tensi darahnya.
Okay, so do you have any questions regarding to the blood pressure?
Ada yang mau ditanyakan terkait tensi?
No?
Enggak?
If no, let's do some practice.
Nah, sekarang kita tes ya.
Okay, so we got two sphygmomanometer here. So do you got the same one at your home?
Di sini Miskonya ada megang dua alat ukur tensi. Teman-teman ada yang punya seperti ini di rumah?
Okay, so after I open, I got a cuff here.
Bisa dilihat ada cup-nya, cuma di lunanya.
And also the pressure meters here.
Alat ukur tekanannya di sini.
Okay. Okay, so do you know how to operate the machine?
Teman-teman tahu cara pakai mesinnya?
Yeah, first, battery is very important. Okay.
Mana ya?
And after that, we can connect our cuff here.
Nah, bisa dipasangkan cuff-nya ke mesinnya.
Okay, and now we invite Sophie.
Jadi pasiennya.
Yeah, to do the demonstration. First, before the measurement, I need to do some preparation first. Okay, so I need to make sure Novi is sleep properly, and she has already rest for 5 to 15 minutes, and her emotion is very calm. Okay, and then I will tell her, okay, Novi, I'm going to measure your blood pressure monitoring now.
Jadi beberapa persiapan dilakukan. Jadi pastikan pasiennya duduk dengan tenang. Lalu nanti akan dibilang, nanti kita ukur ya tensinya. Dan pastikan emosinya juga stabil, tidak terlalu bersemangat, tidak terlalu sedih atau apa.
Okay, and she's very smart because she has already take off her jacket.
Kita penting ya ini teman-teman. Jadi bajunya tidak terlalu ketat. Jadi kalau misalnya ada yang pakai jaket itu kita lepas.
Okay, so if today she wear this clothes and it's okay because the clothes is not too thick, but for some clothes, if the clothes is so thick, we need to roll up the sleeves.
Jadi sekarang saya pakainya yang agak lebar sleeve-nya. Jadi itu tidak apa-apa. Tapi kalau saya teman-teman pakai misalnya kayak daleman Uniqlo gitu kan agak ketat ya. Nah itu harus dilonggarkan.
Okay, and after that, ask her to put her arms on the table. Make sure it's within the heart level, okay? And the palm face upward.
Jadi pastikan sikunya di atas meja, telapak tangannya menghadap ke atas, dan di antara lengan nanti diukur dan jantung itu setara.
Okay, and then put on the cuff on her arms.
Dan pasang di lengan.
And make sure you can see the line here. And the line is also just like this one.
Dan pastikan kabelnya kelihatan di atas lengan sini ya.
And then make sure, okay, she feel okay, relax. And then we can just press start.
Nah setelah dipastikan semuanya aman dan pasien rasa nyaman, kita bisa langsung pencet start.
Can we talk to her during the measurement? No.
Gak boleh ngobrol sama saya selagi saya diukur tensinya ya.
How about if she keep talking to you?
Gimana kalau saya ngomong gini terus? They said to ignore me.
Okay. And we just tell, oh, keep silence. Okay, during the measurement. And then after the reading is okay, and then we can make the documentations of the measurement.
Jadi setelah selesai diukur, kita bisa lihat angkanya dan nanti angka yang muncul jangan lupa kita catat.
Okay, so now we need to do some practice first.
Nah, sekarang kita praktek ya.
And every people got a chance. You need to demonstrate to me how to do the measurement, okay?
Harus kasih lihat Miss Connie ya, gimana cara ukur tensinya.
Okay, we will do the first row first. Okay.
Pertama ya.
Okay, you help her to measure the readings.
Jadi Mbak bantu.
Yeah, and you help her to do the readings. Okay, do you have any questions to ask her?
Sebelum ini ada yang perlu ditanyakan dulu nggak? Sebelum mau tensi.
Like did she rest for 50 minutes or is she a very relaxed position? Okay. Okay, do you have any question? Yeah, relax. Yeah, position. Okay, so just press start. Okay, just press start.
Nah, terus langsung.
Yeah, let's do the measurements.
Langsung pencet start.
Okay. No talking during the measurement. Okay. Okay, she got her. Can I tell the readings? Okay, if you got the reading, the systolic blood pressure is 97/68 and the pulse is 68. Is this normal?
Jadi tekanan darah Mbak siapa? Mbak siapa? Yanti. Mbak Yanti 97.
Okay. Take turns to do this.
Oh, tidak. Oh yeah, sedikit.
They said under 100 is quite low.
Okay, actually yes. Actually, maybe it's not within the normal range, but just very close to the reading. So if you see the current is not within the normal range, and I can ask you some questions like, do you feel okay? Any dizziness or any discomfort? If the condition is okay, then it's okay.
Nah, jadi memang angkanya sedikit di bawah normal.
Okay, take turns to do the measures. Okay, yeah, first mark.
Apa yang dirasakan, apakah ada keluhan sebelumnya, jika semuanya lebih jika kondisinya terlihat baik-baik saja, tidak ada gejala yang ditimbulkan, maka ini masih oke.
Okay.
Nanti harus diukur lagi berapa kali.
Okay, so we now spend like 10 to 15 minutes and make sure everyone has done the blood pressure checking first.
Gantian. Nah, jadi kita ada sekitar 10 sampai 15 menit, kita gantian ya. Jadi nanti setelah teman-teman di baris pertama sudah, nanti teman-teman di baris kedua, teman-teman di baris ketiga, teman-teman di baris keempat.
Take turns.
Take turns, right?
Yeah. Actually, for our arms, we got a brachial artery here. If you use your index finger and your middle finger to just like this one, you got a pulse here. So why is that so important? Because during our measurement, why we put our cuff here? Because we is very close to the artery.
Jadi kalau teman-teman lihat di sebelah sini, itu ada pembuluh darah besar di sini. Jadi kenapa kita taruh?
Okay, this one. Okay, is normal? Normal. Okay, just take off the cuff and pass to there.
Jadi lebih akurat.
Here.
Jadi teman-teman juga kalau misalnya
You can detect your brachial artery. Here, you got a pulse, a brachial artery here. Okay. Here, yes, at the inner side. Here, you got a brachial artery here. Try to detect this one. Okay. Okay, yes, normal?
Yeah.
Okay, just take it off and pass to the other row. If one side is too high, what you can do?
Jadi kalau misalnya yang satu lebih tinggi, kita bisa apa?
You can try to take the blood pressure at the other hand. If one side is very high, and take the other side.
Kalau misalnya kalau tinggi meter ada di sebelah, misalnya di sisi kiri, maka saya coba di sisi kanan. Tidak apa-apa, tapi kan tadi kan masih normal.
And also, if the reading is too high, you need to check if the patient is at the heart level and if the pulse is not properly.
Oke. Dan kalau misalnya waktu diukur tensinya tidak normal, tidak terlalu tinggi, mungkin bisa dipastikan lagi apakah benar prosedurnya, apakah diukurnya sesuai setara dengan jantung dan semacamnya.
And if both hands are so high, okay, then what you can do first, ask the elderly to rest for 15 minutes and take the measurement after 15 minutes.
Kalau misalnya sudah diukur dari dua lengan yang kiri dan kanan sama-sama tinggi, kita minta relaksianya untuk istirahat dulu 15 menit, setelah 15 menit kita ukur lagi.
And check if the elderly got some headache or phobic symptoms.
Dan panggil juga apakah saya terlihat sakit kepala atau mungkin ada gejala pneumonia atau mau imun.
Okay.
Aku suka yang ini.
Okay. Okay, now the readings is error. Okay, error. So what you can do?
Just
Yeah, change another one. Try another hand. One of the reasons is maybe because the jacket. Yeah. So in conclusion, if one hand is not normal, is very high, and then take the other hand, but we need to ask some questions like, did the client take the antihypertensive drugs? Is she sleep properly? And if the other hand is too high, rest for 15 minutes before the other measurement.
Jadi simpulannya kalau misalnya di satu lengan
Okay, is normal?
kita coba
Normal?
lengan lainnya,
Okay.
kita
Okay.
juga bertanya-tanya
The reading is
seperti apa
normal, right?
dirasakan,
Okay.
apakah
Take
sudah,
turns.
sebelumnya
Do you try?
obat. Lalu dan jika masih tinggi kita tunggu 15 menit.
试咗啦，係咪？
istirahat dulu,
試咗
tenang
，OK。
dulu. Baru kita lakukan lagi. Oke.
Okay. Is this normal?
唔係咁好。
唔係咁好，係
因為睇大
有少少低。你平時有冇量血壓？Can you Novi, can you do the translation?
Ini terlalu rendah. Ada nggak sakit kepala atau enggak?
Yeah. 你平時do you measure blood pressure regularly or do you have any
Hipertensi? Enggak. She didn't
any
check.
okay any dizziness? No.
Ada gejala kayak pusing,
Enggak,
gitu
tapi biasanya ada pusing dikit.
She just have like minor headache, but like not regular.
Oh, okay. That's fine. Just pay attention to your readings. Yeah, because actually I got hypertension as well. But if you feel okay, that's okay.
Oke. Nah, jadi kayak di monitor aja. Kalau misalnya Mbak merasa baik-baik aja nggak apa-apa. Tapi kalau bisa sih rutin dicek aja untuk melihat ya.
Do you do exercise? Take turns. Do you do exercise regularly?
Mbak olahraga nggak?
Huh?
Exercise?
Iya,
Olahraganya apa?
paling kita di taman sama Bobo.
Oh, she exercise regularly when she's with the elderly that she can.
Oh, okay.
夠瞓啦。
唔夠瞓，係啊，有影響㗎，唔夠瞓。If you don't have enough sleep, maybe you got hypertension
Juga mungkin ini.
as well. Okay, is correct.
No, ini harus
No.
di atas, di tengah.
Slightly to
Jadi ini dibuka dulu, jadi dibuka.
yeah.
It's not correct, not correct.
Why the latitude in the middle? Because you can see the marking here. Actually, the marking need to place above the brachial artery. Here, she got an artery here. So the latitude at the middle position.
Jadi kan bisa dilihat di sini kan pembuluh darahnya kan di tengah ya. Jadi ini harus ada di tengah.
Okay, is this normal? Okay, so pass to the next group.
Oke, ditanya, oke or not? Oke or not? Oke ya? Oke ya.
Mbak Jenny. Pertama kita siapin peralatannya dan kita suruh pasien kita untuk relax. Siapkan pergelangan
She recites
tangan
all your
pasien.
instructions clearly.
Good students.
Very good.
Yeah.
Dan check the battery.
Wow. Yeah.
Telapak tangan ya, Mbak? Telapak tangan.
Okay, is this normal?
High normal.
High normal. So what you need to do? Ask. Do you have some questions to ask her? You use 廣東話。哦，OK，正唔正常？唔正常，咁你要點做？少少。你問佢問題 like have you done the measurement regularly? Do you have hypertension? No. Okay. So if the reading is not normal, what you can do? 要做啲咩？如果一邊你覺得有少少高，你會唔會量埋另一邊啊？Okay. So take the other side as well. Yeah, very smart. You can see a marking here. Yeah, because our brachial artery is over here.
Okay.
So actually, this side needs to at the middle, and also the marking needs to above our brachial artery. So you have done very, very good.
Thank you.
We need to know the principle why the line need to at the middle side. The same. Okay. Actually, it's a little bit lower, but yeah, it's above normal. So you need to tell her. So need to pay attention, like if you got very stressful recently or not in sleep. You need to monitor.
If here is 201, that is 201. Last time I'm take her the old lady because she have the cancer.
201.
Every day she too much dissing. Then after that, too much. And then sometimes she ask me to give some candy every day.
If 201 is not normal, need to see the doctor.
Every 15 minutes I must try again and she have so much sweating, so much in the night time, and then have too much trouble all the water. But no, she already gone already because I'm taking her almost 3 years.
But does the doctor knows the situation?
Yeah, because she have cancer every day.
Yeah.
Must wash the blood every 1 week 3 times.
So if the doctors already know this situation, and what you can do is just tell her to write the documentation. And if it's not normal, then tell the nurse or tell the doctor about this situation. Because as you said, the kind got cancer. Yeah, so the problem. But actually, if it's quite uncommon even for cancer patient to got such high.
Sometimes 210, sometimes 119, sometimes, and always she like trouble so much. So every night time I'm never sleep so much because too much trouble. And then the doctor tell to use the oxygen in the home every day because she cannot to breathe. Always sweating in the night time and too much change, and then poo coming so much, and then wee coming so much. Sometimes cannot to go wee, I don't know. This for my experience to do for taker the cancer people.
Yeah. You can just write down the documentation and tell them.
Now she's already go. Just for the feet, everything she have problem.
OK， 正常吗？这个正常。好，那你知道这是你是做正确的，就是你这个一定要做在那个中间位置，然后你 take turns，OK？
Yeah, my blood pressure is okay.
OK, normal. Did she try with you? OK.
She has 109.
OK, yes, normal.
81.
正唔正常？正。OK， 好。
Thank you.
Welcome. So girls, remember need to pace at the middle. Okay, this is very important to remember this.
Jadi diingat itu paling penting kabelnya itu di tengah.
Do you have any questions regarding?
Ada yang mau ditanyakan?
唔係，佢頭先想講，即係如果血壓高咧會中風啊嘛，咁如果血壓低咧佢會點？
Okay, 問得非常之好 Very good questions. Our students just said she knows that hypertension will lead to stroke, but how about hypertension? Any side effects for hypertension?
Jadi kalau misalnya darah tinggi itu kan ada kemungkinan resiko stroke ya. Lalu kalau saya darah rendah kayak gimana?
Okay, actually I got hypertension too. So
Resikonya juga menderita darah rendah.
So no need to be too worried. One of the reasons why you got hypertension is because you don't have enough sleep. Yeah, you are tired, or sometimes you do not do exercise regularly.
Jadi kalau kenapa sih kita bisa kena darah rendah? Darah rendah itu
Okay.
disebabkan oleh faktor kurang tidur, kurang istirahat, dan kurang olahraga.
So what you can do is just have some habit modifications, or just take a rest for you just got some enough sleep for you.
Jadi apa sih yang bisa kita lakukan kalau misalnya kita menderita darah rendah? Salah satunya yang bisa kita lakukan adalah istirahat yang cukup.
If you are a healthy person,
Kalau Mbak adalah sehat ya, berarti tidak ada keluhan apapun, tidak ada keluhan penyakit apapun.
but if you are taking some drugs that will lead to hypertension, and we need to aware of the drugs and tell the doctor, oh, I got some hypertension symptoms after taking certain drugs. Do I need to change? I mean, if the reason for you to get hypertension is because you have taken some drugs, the medication.
Drugs, ya.
Yeah.
Jadi kan misalnya dan itu kan pada sebelumnya kayak minum obat gitu ya.
Yeah, and then maybe you can tell the doctors, oh, this kind of medication, I got hypertension after I have taken some medications. Do I need to change the medications?
Nah, dan kayak jadi kita konsultasi ke dokter, karena saya meminum obat ini, tekanan darah saya jadi rendah, saya jadi darah rendah, apa yang bisa saya lakukan?
But are you taking certain medications with you?
Ada minum obat sesuatu gitu nggak?
Then that's not your problem, but for some other people's problem.
Jadi itu bukan masalahnya Mbak ya, tapi mungkin bisa terjadi di orang lain.
Actually, hypertension for some cases is very dangerous, especially if the patient has got some car accidents or during the breathing, and the patients will got hypertension. But if this is not your situation, then no need to be too worried.
Jadi darah itu mungkin bisa berbahaya ya untuk beberapa kasus, misalnya dia kecelakaan atau apa. Tapi jika maksudnya hidupnya sehat, tidak ada keluhan atau gejala apapun, maka tidak perlu khawatir. Pastikan saja yang tadi saya bilang istirahat yang cukup dan kalau bisa tidak.
So for your situation, I just guess you don't have enough exercise or don't have enough rest. No need to be too worried.
Jadi mungkin dalam kasusnya mungkin Mbak kurang istirahat aja, kurang tidur, atau mungkin kurang bergerak atau apa. Jadi
Will you got dizziness sometimes?
pusing nggak?
No, then no need to be too worried. Okay. Any more questions?
Ada lagi yang mau ditanyakan?
No? Okay. Now let's move to the body temperature.
Oke, sekarang kita beralih ke suhu tubuh ya.
Okay, so the next vital sign is body temperature. And the body temperature includes the core temperature and also the peripheral temperatures.
Nah, jadi suhu tubuh itu kita bisa bagi jadi dua. Suhu tubuh ada suhu tubuh inti yang ada dalam tubuh kita dan suhu tubuh di permukaan yang periferal.
And there are also some factors affecting our body temperatures like age, environment, exercise, diet, and also disease.
Faktor-faktor yang mempengaruhi suhu tubuh salah satunya seperti umur, lingkungan sekitar, pola makan, dan penyakit.
Okay, so same as blood pressure, we need to avoid the following activities 30 minutes before measuring the body temperature, like exercise, bathing, eating, smoking, and also excessive emotion.
Nah, seperti tadi kita mengukur tensi, ada juga beberapa persiapan yang kita lakukan sebelum mengukur suhu tubuh. Jadi jangan melakukan aktivitas ini setengah jam sebelum mengukur suhu tubuh, seperti olahraga, mandi, makan, merokok, atau emosi yang berlebih.
Okay, so what is the normal temperature? The normal temperature of a human body is in between 36.1 degrees Celsius to 37.2 degrees Celsius. That's the normal range of the body temperature.
Jadi apa sih yang disebut sebagai suhu tubuh normal? Kalau di manusia suhu tubuh normal itu kisarannya di antara 36,1 Celsius sampai 37,2 Celsius.
Okay, actually we have five sites for measuring the body temperature.
Jadi kita sebenarnya ada 5 lokasi di mana kita bisa mengukur suhu tubuh kita.
The first one is oral, put under our tongue.
Yang pertama di mulut, ditaruh di bawah lidah.
Anyone tried this method before?
Ada yang pernah mengukur suhu tubuh di mulut, di bawah lidah gitu?
No. Some yes, some no. Okay, the rectal temperature is the second method. Anyone tried this before?
Yang kedua dulu, ada yang pernah mencoba?
No. Okay, actually, if you are for infants or baby, actually they use this method.
Kalau misalnya bayi, mereka menggunakan mengukurnya dari buku.
Okay, and also the axillary temperature put under here.
Nah, setelah itu di ketiak.
The ear temperature? Yes. And the forehead temperature? Okay, so which one is better, you guess?
Yang mana yang lebih baik? Forehead. Someone say forehead. Ada lagi ya? Lidah. Yeah. Someone say oral. Gimana? Telinga. And someone say ear.
Okay, actually we prefer the ear one.
Ya, jadi yang lebih lebih bagus itu di telinga ya.
Yeah. Why? Because the ear actually we put a thermometer inside our ear canal and it's very close to our core temperature.
Jadi kenapa yang telinga lebih baik? Karena saat kita mengukur dari telinga, si ujung termometer itu dimasukkan ke dalam saluran telinga kita. Dan saluran telinga kita itu yang paling mendekati suhu tubuh inti kita.
Forehead is okay, but actually if we just put here, some air is in between the sensor and also our skin. Maybe it's not so accurate compared to the ear one.
Jadi kalau saya dahi yang masih tutut itu, di dahi itu kan ada jeda ya. Jadi di antara dahi mungkin ada angin dan di antara kulit kita ya udara, dan itu mungkin akan mempengaruhi akurasi dari pengukuran suhu tubuh.
The oral one is also okay, but actually it takes a longer time, and also if for some children or elderly, maybe they will bite the thermometer. Yeah, it's very dangerous.
Kalau untuk mulut juga bisa, tapi untuk beberapa kasus untuk pengukuran suhu tubuh dari mulut itu memakan lebih lama waktunya, dan untuk beberapa kasus orang-orang itu tidak nyaman diukur, dan bisa aja termometer digigit.
For rectal, actually it's good too, because it's very close to our core temperature, but it's very embarrassed to do this one.
Okay. Sebenarnya dubur juga paling mendekati suhu tubuh inti, tapi ya malu-maluin aja.
Yeah, and also the last one here, actually we seldom do this because it's also at the surface our skin maybe is not so accurate.
Nah, kalau ketiak juga kurang direkomendasikan karena dia hanya berada di permukaan, jadi suhu tubuhnya tidak terlalu kuat.
So here's the thermometer, the oral one, put under our tongue, and also the ear temperature.
Jadi termometer seperti ini teman-teman, yang di sebelah kiri yang warna biru itu yang untuk di lidah, untuk yang di mulut, ditaruh di bawah lidah, dan yang di tengah ini adalah untuk telinga.
Okay, so let's talk about the oral temperature first. Actually, the oral temperature is very suitable for conscious and cooperative patients, and they are able to close the mouth. So if they can't close the mouth, then don't use the oral temperature. And it's not suitable for someone who is difficult in breathing, and they cannot close the mouth and unconscious and also uncooperative.
Jadi kita bicara dulu untuk pengambilan suhu tubuh di mulut. Sebenarnya metode ini cocok untuk pasien yang sadar dan bisa diajak berkomunikasi, dan pasiennya bisa menutup mulutnya. Tapi ini tidak cocok untuk pasien yang mungkin susah bernafas, tidak bisa menutup mulutnya dengan benar, dan atau pasien yang tidak sadar dan tidak diajak berkomunikasi.
Okay, so actually oral temperature No hot or cold food or drinks 15 minutes before the measurements. And also, we need to cover the thermometer by a clean disposable plastic shield before using.
Jadi kalau untuk mengambil suhu dari mulut, yang pertama kita tidak boleh mengkonsumsi makanan atau minuman panas atau dingin 15 menit sebelum diukur, dan termometernya nanti ditutup dengan sarung plastik yang bisa dibuang sebelum dipakai.
Yeah, and just put under the tongue for like 1 minute.
Dan nanti termometernya ditaruh di bawah lidah dan ditunggu selama 1 menit.
Okay, under the tongue. So the next one is the rectal temperature, and actually is for like unconscious clients, and also for baby or infants, and for those who are unsuitable for taking oral temperature.
Nah, untuk pengambilan suhu dari dubur ini sebenarnya cocok untuk bayi, untuk balita, atau untuk pasien yang tidak sadar, dan juga untuk pasien-pasien yang tidak bisa mengambil suhunya dari mulut.
And it's not suitable for some rectal disease or they got wounds over the anus.
Dan ini tidak cocok untuk orang-orang yang mungkin menderita penyakit di sekitar duburnya, atau jika dia memiliki luka di sekitar area anusnya.
Okay, so we can just apply the lubricants over the thermometer before measuring and put into the rectal canal.
Jadi untuk pengambilan suhu dari dubur, kita pertama pasang dengan lubrikan gitu seperti minyak pelumas di atas termometernya sebelum kita masukkan ke dalam area duburnya.
Okay, so for the auxiliary temperature actually is suitable for those unsuitable for taking oral or rectal temperature or for the unconscious patient.
Jadi untuk pengambilan suhu di area ketiak ini cocok untuk pertama pasien yang tidak bisa mengambil suhunya secara di dalam mulut atau di dubur, atau untuk pasien yang tidak sadar.
And it's not suitable for people who are too thin.
Dan tidak cocok untuk orang-orang yang terlalu kurus.
And we can just put under our auxiliary for like 20 to 15 seconds.
Untuk pengambilan suhu di ketiak, kita hanya taruh saja di antara ketiak kita dan tunggu selama 20-50 detik.
And for the ear temperatures, actually, yes, the most common ways, because for conscious or unconscious patient, we can do this. And yes, suitable for those unsuitable for other methods.
Jadi untuk pengambilan suhu di telinga ini pengambilan suhu yang paling umum karena bisa kita lakukan baik pada pasien yang sadar ataupun tidak sadar, dan untuk pasien yang mungkin tidak cocok dengan pengambilan suhu yang sudah kita bahas sebelumnya.
And yes, not suitable for patients who got ear disease.
Tapi tidak cocok untuk pasien yang mungkin mengalami menderita penyakit di daerah telinganya.
And actually, this method is very fast because we just put inside our ear canal for 1 to 2 seconds.
Dan ini pengambilan suhunya dengan metode yang paling cepat karena kita tinggal masukin saja ujung termometernya ke dalam saluran telinga dan tunggu 1-2 detik.
Okay, actually you can see that we use the infrared sensing probe, and we got a probe here. First, we need to put the probe on the thermometer. That's the first step.
Oke, jadi teman-teman bisa lihat termometer telinga seperti ini. Di ujungnya itu menggunakan sensor infrared untuk mendeteksi. Jadi ujungnya itu nanti kita cover, kita tutup dengan sarung plastik yang bisa dibuang.
And it's very important to put it forward and downward along the ear canal.
Jadi yang paling penting adalah ujungnya itu kita tunjuk agak ke depan dan ke bawah di arah saluran telinga yang ke arah gendang telinga.
That means just like this one, here's our ear, and we need to put it forward and backward, and then put the ear probe inside our ear canal. Do not just put the thermometer inside our ear.
Jadi bisa dilihat tadi yang sudah dijelaskan Miss Connie, telinganya di tilting, digesek depan belakang sebelum dimasukkan termometernya ke dalam saluran telinga.
Yeah, just like this one, slightly forward and downward along the ear canal.
Bisa dilihat dari ilustrasi di PowerPoint ini ya.
Okay, so for the forehead temperature, actually, yes, also for those unsuitable for taking other methods, and yes, also suitable for the conscious or unconscious patient.
Jadi untuk pengambilan suhu yang di dahi itu juga cocok untuk mungkin orang-orang yang tidak bisa mengambil suhunya dengan metode-metode sebelumnya. Dan ini juga cocok untuk pasien baik yang sadar maupun yang tidak sadar.
And if too hot or too cold environment is not suitable, so if too hot or too cold or with sweating.
Dan ini tidak cocok jika kita melakukannya dalam udara yang terlalu dingin, misalnya sedang lagi musim dingin atau sedang udara yang terlalu panas. Ini juga tidak cocok misalnya jika kita berkeringat.
Okay, and actually it's very fast, like just 1 to 2 seconds.
Suhunya juga cepat, hanya 1 sampai 2 detik.
Okay. And also it's very important to clean the thermometers. For the electrical one, we can dispose of the used plastic cover shields. For the E-type one, we can also dispose the used plastic prop cover.
Jadi membersihkan termometer juga penting untuk yang elektronik dan yang untuk yang telinga. Nanti di ujungnya itu ada sarung plastik, itu harus dibuang setelah digunakan.
So use once only for the ear prop.
Jadi untuk yang ujung telinga itu hanya sekali langsung dibuang.
Okay, so actually for the rectal and also the ear temperature is 0.5 degrees Celsius higher than the oral temperature. And for the axillary temperature is 0.5 degrees lower than the oral temperature.
Jadi bisa dilihat di sini untuk bagaimana cara kita memahami suhu tubuh. Kalau kita menghitung dari dubur itu 0,5 derajat Celcius lebih tinggi daripada suhu tubuh yang kita ukur di mulut. Tapi suhu tubuh yang kita ukur di ketiak itu 0,5 derajat Celcius lebih rendah daripada suhu yang kita ukur di dalam mulut kita.
So remember, different methods got different normal range.
Jadi tiap metode yang kita pakai itu ada range-nya yang berbeda juga.
And for our normal body temperature, just like we have mentioned, is 37.2 to 36.1 to 37.2. That means if higher than this level, we got fever.
Jadi dari yang sudah kita bahas, suhu tubuh normal manusia itu jaraknya antara 36,1 sampai 37,2. Jika di atas itu, maka bisa disebut pasien tersebut menderita demam.
So please bear in mind the readings.
Jadi diingat-ingat lagi angka-angka ini ya.
And for abnormal body temperature, we need to report to our family relative and also arrange to see the doctor.
Jadi kalau misalnya kita ukur suhu tubuhnya abnormal, mungkin di luar keadaan normal tadi, misalnya pada lansia mengalami demam yang cukup tinggi, pertama pastikan kita langsung menghubungi anggota keluarga terdekat dan segera menghubungi dokter.
Okay, do you have any questions regarding to the body temperatures?
Ada pertanyaan terkait suhu tubuh?
No? Okay, so last one, let's talk about the blood sugars level.
Nah, yang terakhir kita bicara tentang gula darah.
Anyone measures the blood glucose level for your family members?
Ada yang juga ngecek kadar gula darah untuk para lansia ini?
Someone, yes. Okay, use this one.
Pakai ini.
Okay.
Cuma satu, ada yang lain enggak? Oh, she did it by herself.
Oh, okay. So, okay, actually what is the blood sugars level? Actually, the blood glucose, that means the blood sugar is a very important source of energy in our cells and it's very important for all the metabolic functions inside our body.
Jadi gula darah itu apa sih teman-teman? Gula darah itu sebenarnya sangat penting bagi kita untuk membakar energi dalam tubuh kita dan juga salah satu zat yang penting untuk menjaga fungsi metabolisme di dalam tubuh kita.
Okay, so for patients suffer from diabetes, that means their body cannot have enough insulin and it leads to high blood glucose level.
Jadi diabetes itu apa sih? Diabetes itu adalah di mana saat tubuh pasien tidak bisa memproduksi cukup insulin sehingga meningkatkan kadar gula darah dalam tubuhnya.
That means every time, let's say during our lunch, we eat the rice and the rice automatically broke down into the glucose, and the glucose is the energy of our cell, and our cell will take the glucose.
Jadi misalnya nih, kita makan nasi. Dalam tubuh kita nasi itu akan menjadi glukosa. Nah, glukosa itu akan diambil oleh sel darah kita untuk dijadikan energi.
And we can only do this procedure if for the use of insulin, the insulin help us to do the process. So if our body do not have enough insulin, and that means the blood glucose cannot enter the cell. And our blood vessel got so many sugars, so many glucose here, and that's called the diabetes.
Jadi itu kalau misalnya dalam tubuh normal. Nah, lalu kalau misalnya dia tidak bisa dalam untuk penderita diabetes, dia tidak bisa melakukan prosedur itu karena dia tidak punya cukup yang namanya insulin. Jadi apa yang terjadi? Glukosanya tidak bisa menjadi energi. Jadi glukosanya numpuk di pembuluh darah dan menyebabkan diabetes.
So it's very important to measure the blood glucose level, and it can help detect the low blood glucose and also the high blood glucose.
Jadi sangat penting untuk mengukur kadar gula darah yang dalam tubuh kita. Jadi kadar gula darah tersebut bisa membantu kita untuk mendeteksi kadar gula rendah atau gula tinggi.
Okay, so let's remember the normal readings. For the normal blood glucose level, actually is 4 to 7 before the milk, that means in the fasting status, and it's acceptable for the diabetes patient in between 4 to 7.
Jadi ini ada angka-angka lagi, diingat ya teman-teman. Kadar yang normal itu misalnya sebelum sarapan, jadi sebelum makan itu kisarannya 4 sampai 6. Kalau untuk penyakit orang dengan penyakit diabetes, kadar normalnya itu di antara 4 sampai 7.
Every time when we measure the blood glucose level, we need to measure in a fasting state. That means before the milk or before any breakfast or lunch.
Jadi yang paling penting mengukur gula darah itu waktu saat puasa. Jadi sebelum ada makanan yang masuk ke dalam tubuh kita.
Okay, so when to check, just like I mentioned before any milk and also post milk 2 hours and also during bedtime. Why post milk 2 hours? Because after we have finished our lunch, actually we digest, and actually it takes like 2 hours for our blood glucose readings to reach normal.
Jadi bisa dilihat di sini kapan saja sih kita harus mengukur kadar gula darah kita jadwalnya. Jadwalnya yang sebelum sarapan, sebelum makan siang, sebelum makan malam. Lalu setelah makan 2 jam setelah makan, lalu saat tidur. Kenapa 2 jam setelah makan? Karena saat kita makan, tubuh kita itu butuh waktu 2 jam untuk mencerna makanan yang masuk ke dalam tubuh kita. Nah, nanti dari situ kita bisa melihat setelah pencernaan kadar gula darah normal kita dalam tubuh kita tuh dalam kisaran berapa.
Anyone having breakfast this morning?
Ada yang sudah sarapan?
Yes. Okay. So yes, suitable. Now we take the blood glucose level.
Nah, jadi ini waktu yang tepat nih untuk kita mengukur kadar gula darah kita.
Yeah. I guess yes, because actually we start our lessons at 9:30 and it's already 2 hours after our breakfast.
Jadi kan sudah 2 jam setelah teman-teman sarapan ya. Jadi ini ada waktu yang pas untuk kita mengukur kadar gula darah kita.
Okay. So actually we got some preparations here and I will show you later. It includes the glucometers. Actually I will show you later, okay? So here's the procedures of measuring the blood glucose level. Anyone done this before?
Ada yang pernah mengukur gula darah sebelumnya pakai glukometer, pakai alat ukur gula darah? Belum? No.
Not yet. Okay, so first one we can wash our hands first.
Yang pertama, cuci tangan.
And then clean the fingers using the alcohol swab, just like this one.
Dan kedua, kita bersihkan ujung jari dari pasien dengan alkohol.
And here's we got the glucose meter, and I will demonstrate this to you later. We need to prepare this one.
Dan di misalnya namanya glukometer atau alat ukurnya, nanti kita praktekkan bagaimana cara memakainya.
And we got the strip here. Okay, just put the strip inside the glucose meter, and then the machine will turn on by itself.
Nah, stripnya nanti dimasukin dalam mesinnya dan nanti mesinnya akan nyala sendiri.
Okay, and then we got a needle here. Just remember we have already disinfected the hand, and then just use the needles to get a drop of blood, and then put the blood on the strip, and we can get the readings of the glucose level.
Jadi ada juga namanya jarum. Nah jarum itu kita tusuk ke dalam ujung jari. Pastikan ujung jari sudah dibasuh dengan alkohol, sudah diusap dengan alkohol. Nanti darah yang sudah kita ambil, kita taruh di glukometernya untuk nanti kita ukur gula darahnya.
And remember, we still got the wound here on our finger, right? So we need to use the cotton wool ball or gauze to cover the wound.
Nah nanti itu jari yang sudah dicucuk itu kan masih berdarah. Jangan lupa langsung ditutup dengan kain kasa untuk menghentikan pendarahan.
So we can do it at our fingertips. And it's better to just like this one. First, rub our hand and make sure the blood at our fingertips, okay? And then get the blood drop over here at the surrounding sides. You will get less painful. If you do this here, you will feel a little bit painful here, okay?
Ya, jadi ingat yang pertama kita bersihkan dengan alkohol, lalu jarumnya dicucuk di atas sini. Kalau misalnya teman-teman takut jarum, takut sakit, di sini nggak terlalu sakit.
And after that, we got the result. We got a sharp brush here, okay? Here's the used needle. We need to throw the needle inside the sharp brush, but not in the rubbish bin because the needle will hurt others people.
Nah, jadi jarumnya harus dibuang secara terpisah. Jangan dimasukkan ke dalam kantong sampah yang biasa teman-teman pakai karena jarum tersebut bisa membahayakan orang-orang yang mungkin bersihkan sampah.
So for extremely high readings or low readings of blood glucose level, we need to consult the doctor at once.
Dan untuk kalau gula yang terlalu tinggi atau yang terlalu rendah, kita harus segera berkonsultasi pada dokter.
For hypoglycemia, that means high blood glucose level, as we have just mentioned, the patient will got diabetes. But for the hypoglycemia, that means the low blood glucose level, the patients may got dizziness, sweating, or they don't have enough energy. They will got dizziness.
Oke, jadi untuk untuk gula darah tinggi, tentu itu gejala dari itu menyebabkan diabetes. Tapi untuk orang yang memiliki kadar gula darah rendah, itu beberapa gejalanya seperti dia jadi pusing, gampang pusing, jadi sering keringetan, dan jadi tidak punya cukup energi, jadi gampang capek, gampang lelah.
Okay, so now let's do our demonstration.
Nah, kita berdemonstrasi ya.
We got a sharp box here, and the script,
Ini kotak sampahnya dan stripnya,
the needle, the glucose meter.
jarum dan glukometernya.
Okay. 其實如果時間夠，佢哋 OK 咧，可以互相試下。你覺得？佢頭先血壓每人都量咗一次。係啦，如果佢哋唔介意跟一滴血嘅話 ，OK。
因為咧呢個未用完嘅，咁如果呢度可以嘅，有啲都可以擺落。
可以，我用咗呢個先啦。
係啦。咁如果嗰個呢個敷咗咧，就擺嗰邊，就唔使冚蓋。
明白。
因為冚蓋佢哋話好似開唔到。
係嘅，比較難開。好啊，可以啊，冇問題，唔該晒。OK。Okay, and we will now do a demonstration here. And actually, it's voluntary. Okay, why? Because you still got a little bit painful. Because I want to get a drop of blood for you, so it's voluntary. If you don't want to do that, okay. But if you want to do that, then you can measure your blood glucose level for free.
Nah, jadi ini secara sukarela ya. Kalau misalnya teman-teman takut atau merasa nggak nyaman, nggak apa-apa. Tapi kalau teman-teman mau, lumayan kapan lagi kumpul gula darah gratis.
Okay, so anyone want to be the first one? Okay. You really? You get hers. Okay, so you might know feet to do the volunteer first. First, I need to wash my hands using the hand rub. It's very important.
Kitanya juga tangannya bersih ya.
Yeah. And then also disinfect her hand first. Which fingers you want? This one, okay.
Jadi saya menggunakan jari telunjuk saya, nanti dibasuh dengan alkohol,
Make sure the alcohol has dried first.
Pastikan alkoholnya sudah kering.
Okay. And then I put the script inside the glucometers,
Stripnya dipasang di glukometernya.
and you can see the machine has turned on.
Langsung mesinnya nyala.
Here's the needle.
Ini jarumnya.
First, I open the needle first,
Jarumnya dibuka terlebih dahulu.
and then I remove the needle cover.
Dibuka bungkus jarumnya.
And then, okay. And then we just put the button here.
Lalu dipencet jarumnya.
Okay. Okay, she got a drop of blood here.
Kelihatan ada darahnya.
Okay. 5.4, is this normal?
5,4 normal.
Before milk, okay, yes, normal.
Sebelum sarapan.
Sorry. Yeah, post meal 2 hours or before the lunch. Yeah.
Setelah 2 jam setelah makan atau sebelum makan siang normal apa tidak?
Normal. Okay. So you have finished the procedure, and then remember her hand. Okay.
Jadi jangan cuma lihat angkanya, tolong diingat.
Help her to stop breathing first. Okay.
Ditekan sampai darahnya berhenti dulu.
If you got some bandage inside your home, you can just put the bandage on the
Kalau
finger.
misalnya di rumah ada Hansaplast, bisa juga pakai Hansaplast.
Okay. And actually, the wound is not too large, so it's okay.
Sebenarnya lukanya juga nggak gede-gede banget, jadi ini udah berhenti, jadi oke.
And then remember the sharps, how to handle.
Nah, jadi ingat jarumnya bagaimana
We
setelah
will,
kita pakai.
we will put inside the rubbish bin the sharp balls.
Nah, dibuang ke tempat sampah khusus untuk benda tajam.
Okay, and then just take off the strip, and
Stripnya
this one can put in the rubbish bin.
stripnya bisa dibuang ke tempat sampah biasa, tapi kalau jarumnya harus dibuang ke tempat sampah terpisahnya untuk benda tajam.
And then hand rub again.
Dan cuci tangan lagi.
Okay, so anyone want to try?
Siapa yang mau?
Okay. We'll do it here. Okay, first hand rub. Yeah. Okay, so you have her to do it twice. Okay, you have already hand rub, and then here's the glucometers. You can take out one of the script. Yeah. You have done this by yourself, right?
Sudah pernah, Mbak? Sudah pernah.
You're familiar with this one?
Tiap hari, every day.
Oh, every day, okay.
Oh,
Diberikan
Okay.
bos. Aku diberikan bos. Berikan. Oh, infantile.
Because actually every script is different. You can see the blood here, so that means we do it this. Try again.
Nggak sama.
Try again. Push.
Oh, it's different from the tool she used at home.
Yeah. Okay, so help her to do the swab.
Pastikan kering.
Okay. And here's the needle. Do you use this needle before?
Pakai jarum ini di rumah?
Okay.
Sama.
Oh, it's different from the tool
Okay.
she used at home.
Trace. That means trace this. That means open, and then trace the needle cover.
Jadi puter,
Try this.
jadi diputer. Terus nanti lagi.
Do you want to do this?
Yes, yes.
Okay. Just take a look first, and then I will come here. Here's the needle. Okay. Okay. This close. Okay. Open, and then twist this one. We can remove the needle cover, and then just press.
Mau tanganmu melok.
Here the strip, just take a look first. You can see here's a blood sample here. Just try to put inside the glucose meter.
Nggak bisa. Dipencet aja ya, gini loh. Nah, gini. Iya, alatnya kan. Tapi kepencet.
Yeah, well done. Okay, try the glucose. Okay.
Enggak. Gimana? Oke.
Because the time is too long. Okay, if this close is okay. Try another one. Okay, try.
Oke, darah ya. Hai loh, enggak.
Okay, help her to press her finger. 5.1
Normal.
is normal. Okay, so how
Jadi gimana cara buangnya?
put the sharps?
Jadi buang di sini.
Ini sudah dicabut.
Iya, ini kan ini udah dipakai. Nah, jadi langsung bawa ke sini.
Because
Iya.
okay,
Jadi sekali jarumnya jangan dipakai 2 kali. Itu juga.
okay, then finish. Okay, then take it off.
Kena darah situ.
The throw here.
Kan lah.
Dạ, lấy bao tặng cho her. Okay. Okay. Oh. If you got him jack froze, try again. Yeah? Okay, maybe no electricity for this one. Then use this one. Okay, and who want to try? Who can try one? Okay, so you help her to do this or who help you to do this? You help her to do this?
I don't know.
Okay.
I'm not understand how to do.
Well done. Then you just do it. First, hand rub. And then help her to hand rub.
Ini ya? Ini apa ini sih?
Ini itu
Ini
jarak
tengah aja.
Okay, it's okay. Few times is fine. And then here's the pressure meter. You try again. Put inside the glucose meter. Okay, put it here. Here's the needle. How to open? Twist it. Twist this and then twist here. You try. Okay, let's open first. Hold my hand. Okay, just like this. Twist. You feel? Can you feel?
No.
You try. This. Yeah, you have already opened. And then twist here. Open this one. Open this one. Twist. Take it off. Yes, well done. Okay, which finger?
This one.
This one. Okay, hold this one. And then you a little bit painful. Okay, and press here.
Okay. Like this ah?
Yeah, press here. Yeah, okay.
Oh.
And then take this with you. Get a drop of blood.
Like this.
Yes. Okay, finish. How to handle her wound? This is
one.
not clean one.
This one is
Okay.
okay ah?
It's okay. 4.9 is normal?
No.
No? Think again.
Ini normal berapa?
49.
Iya, kan dari normalnya
Okay.
4 sampai 7.
Oh iya.
Okay. How to handle the sharp disinfect to the.
Jadi jarumnya dibuang ke sini. Kalau yang tadi bekas darahnya.
We can try 2 to 3 more because we are running out of time. Who want to try?
Jadi bisa coba 2 atau 3 kali lagi ya.
1, 2. Okay, 2 group. Okay.
Oke.
Mana lagi?
Sama Maca tadi dibersihkan tangannya.
Aku latihan.
Sure, you can. You can record, take pictures. Okay, you has to do you disinfect her hand? Clean the hand, clean the fingers.
Ini? Iya. Ya, satu pinggir aja ya, San.
Okay, put it here. Okay, And then how to open the needle first? This is the closed one. You need to twist to open. Try to open. Try to twist first. Okay. Okay. And then twist again this one. Circular motion. Twist it to remove the needle cover. Okay. Try to twist. Take off the needle cover. Yes, well done. And then hold her finger, and then yeah. Okay, well done.
Oke.
Okay.
Langsung glukonnya diambil.
Drop. Okay.
Langsung di.
How to handle her wound? Okay, 5.0 is this normal?
Normal.
Okay, well done. And then put the sharp. Okay, she still got breathing. She's still got breathing, so you need to hold it for a while for her to stop the breathing. Okay.
Normal ya.
Yang jarumnya aja yang dibuang.
And then for the only put the sharp.
Jarumnya aja. Nah, itu dibuang sini.
Only put the
Itu
sharp.
langsung aja.
For other rubbish, you can put inside the rubbish bin. Okay. And then finally hand rub. Okay, your turn.
Alhamdulillah normal.
Yang pertama di ini dulu.
First, hand rub first. Okay. Okay. And then yeah, open it. Take out a strip. Put inside.
Yang merah ini.
Okay. Help her to disinfect her hand.
Aku diam ya.
Aku juga nggak apa-apa. Oh, she's afraid of needle.
Okay. And then dry first, and that's the needle. How to open? This is closed. Twist it to open, and then rotate to remove the needle cover.
Oke, itu udah dibuka.
Just
Yang
rotate the needle cover. Well done. Well done.
Putar. Nah.
Okay.
Oke. Ditekan jarinya. Bismillah. Bismillah dulu, Mbak.
She just got you just help her to disinfect, but you have already don't do that first, because just now you already contaminate her area, so you need to do the disinfection first.
Jadi kalau misalnya tadi kepegang tangannya harus di ini lagi.
Sini ya.
Okay, well done. Okay, drop. Okay, how to handle her wound? Help her to cover this one first. 5.4 is this normal?
5,4 normal.
Oke, normal.
Okay, normal. Well done. So hold this for like 1 minute and put the sharps inside the sharp box. Okay.
Sampah lain dibuang di tempat lain.
And be aware because got another people's blood here. So don't use your bare hand to touch the blood. Okay, you can use some tissue paper. Okay. Okay, and then throw away to the rubbish. Okay, sure. Okay, so any questions?
Ada yang mau ditanyakan?
It's okay to, yeah?
Gak apa-apa, ada yang mau ditanyakan dulu?
Okay, so no questions? Yes, interesting? do
Gula darah, ada yang mau ditanyakan?
you feel painful?
Sakit nggak? Yang tadi diucuk-ucuk sakit nggak?
Okay, so for our podcast quiz, let's talk about the answer. First one, body pressure, blood pressure, body temperature, and blood glucose level are important vital signs. Actually, it's true. It's correct.
Nah, jadi kita kembali lagi tadi ke kuis yang pertama. Tensi darah, suhu tubuh, dan kadar gula darah adalah tanda-tanda vital yang penting untuk menunjukkan kondisi badan ya.
Okay, so diastolic blood pressure is the pressure produced by blood vessels during contraction. Actually, it's not true. It's during the relaxation.
Jadi tekanan darah diastolik adalah tekanan yang ditimbulkan oleh pembuluh darah selama jantung kontraksi. Itu salah ya. Diastol itu relaksasi.
Okay, question 3. Normal systolic pressure should be less than 120, whilst diastolic pressure should be less than 90.
Tekanan sistolik itu harus di bawah 120 dan tekanan diastolik harus di bawah 90. Itu juga salah ya.
Oh, it's not true. You can see, you can trace back for the normal range. Okay. So this one is not true because actually we usually use the arm touch sphygmomanometer instead of the wrist type.
Jadi alat ukur tensi untuk pergelangan tangan itu tidak lebih akurat daripada yang alat ukur tensi yang ditaruh di lengan. Jadi lengan itu lebih akurat.
Okay, and this one should be at the same level as the heart while measuring the blood pressure. Is correct.
Alat ukur tensi yang dipasang di lengan harus setara dengan jantung sebelum mengukur, itu juga benar ya.
So questions 6, when measuring our ear temperature, remember move forward and then backward and then downward along the ear canal. Is true.
Jadi untuk mengukur suhu tubuh di telinga, kuping telinganya harus digeser depan belakang selaras dengan saluran telinga ke arah gendang telinga. Itu juga benar ya.
Okay, so question 7, actually rectal and ear temperature are 0.5 lower than oral temperature. Yes or no? No, it's higher. Okay, so question 8, we should avoid exercise, smoking alcohol half an hour before measuring blood pressure. Is true.
Jadi jangan berolahraga, merokok, meminum alkohol, kopi atau teh setengah jam sebelum mengukur tensi darah.
And question 9, we can measure the blood glucose level for diabetes patient before the breakfast, before meal, or 2 hours after meals, and at bedtime. Is true. Remember the time.
Jadi jadwal rutin untuk mengukur gula darah untuk lansia yang pengidap diabetes adalah sebelum sarapan, sebelum makan, 2 jam setelah makan, dan sebelum tidur.
Do not take this after your milk. The readings will be too very high, okay?
Jangan langsung mengukur gula darah habis makan ya, nanti gula darahnya tiba-tiba naik.
Okay, last one. With extreme high or sudden drop of blood glucose level, we need to see the doctor, and that's true.
Jadi untuk para lansia yang gula darah tiba-tiba naik atau tiba-tiba turun, kita harus segera berkonsultasi pada dokter.
Oh, do you have any questions?
Ada lagi yang mau bertanya? No?
Okay, if no, actually we finish our lessons today. Yeah, and you will still have your lessons next week. But actually today is my last lesson for you guys, girls. Okay.
Minggu depan masih ada kelas lain, tapi hari ini ada kelas diskoni yang terakhir.
Yeah, I'm very happy to meet you girls. You are very smart and brave. Yeah, because later the dietitian and also the occupational therapist will have the lesson with you guys.
Jadi untuk minggu depan akan ada mentor lain terkait ahli gizi dan terapis yang akan berikan materi-materi lain untuk teman-teman.
So at last, would you mind if I take pictures with all of you? Yeah. Okay. Yeah. Maybe I find someone to help first.